My name is George Youngblood. I'm the CEO of Teen and Family Services. Teen and Family Services is honored to partner with Tomball Independent School District to identify students who are experiencing behavioral health needs through the Tomball RISE program. Teen and Family Services, or TAFS as we are known in the community, has been working with teen populations in Houston for the past 19 years. We are a community of recovery for families growing and healing from teen substance abuse and other high-risk behaviors. Teen and Family Services provides teens and entire family systems the tools, skills, and knowledge necessary to deal with substance abuse problems in a holistic way. We've designed a program that encompasses the entire family so that parents get the support they need, and we're able to help adolescents get back on the right track to re-engage with their families, continue their education, and look towards college in the future. Teen and Family Services after-school program utilizes the Alternative Peer Group Model, or APG. The APG model is a program specifically designed to meet the needs of adolescents struggling with substance use disorders. It involves emphasis on peer group change, emphasis on character building, and emphasis on family systems. This focus on peer group change is one of the primary change agents. When adolescents continue to associate with peers who are abusing substances, it makes it almost impossible for them to maintain abstinence. Research on the efficacy of alternative peer groups can be found on the Association of Alternative Peer Groups website. Within the alternative peer group, Teen and Family Services utilizes an evidence-based curriculum called Reconnecting Youth. This curriculum out of the University of Washington has been found to increase school performance, decrease drug involvement, decrease suicide risk factors, increase protective factors, and upon completion of this curriculum, when compared to control groups, major outcomes of Reconnecting Youth students show significant improvements, particularly in decreasing 3 risk factors and increased protective factors such as personal control, problem solving and coping, and access to support. More information about Reconnecting Youth can be found on the Reconnecting Youth website. TAF's role in Tomball's Restore, Instruct, Support, and Educate program is to provide behavioral health screening and interventions for students who are suspected of having substance use challenges. The RISE program serves as a support service for any Tomball ISD student suspected of having a substance use disorder. As a result of the RISE program, Tomball ISD was able to formally implement the restorative practice aspect of the Code of Student Conduct. This change in the restorative practices portion of the code allows for a 15-day reduction in alternative school placements for students who are in violation of the code. Based on the results of the screening, the counselor will make a recommendation for continued care. We set up a continuum that best serves each individual student to maximize their chances of success. Since the implementation of the RISE program in the 2018-2019 school year, 204 students have completed the program. Since the 2018-2019 school year, suspensions have been lowered from 2,939 to 966 in the 2020-2021 school. In 2018-19, 79 students were referred to the RISE program. In 2019-20, 75 students. And in 2020-21, 50 students were referred. Many students were attending school virtually that year, and we did not receive as many substance abuse violations as years prior. Students with drug or alcohol offenses are identified by their campus as a candidate to be screened by one of our counselors. The campus administrator will contact Teen and Family Services to set up a date and time for the student to be screened via TISD@TAFS.org. Once the email is received, Teen and Family Services will schedule and administer the assessment within 48 hours. The results of the assessment will be provided immediately upon completion. Students who present with no risk of substance use will be asked to complete an online prevention program to help educate the student about the dangers of substance use, and students who present with a strong indication of having a substance use disorder will be recommended to participate in the Teen and Family Services after-school program. This program is designed to maximize their opportunity to get further support for themselves and their family members. As part of the screening process, Teen and Family Services utilizes a tool known as the SASE. It was developed to fill the need for a reliable, valid, and standardized instrument for an evaluation of adolescent substance abuse. The SASE helps distinguish teens with substance use disorder from those without. The SASE uses an age-appropriate multidimensional assessment. It focuses on 7 domains: chemical use, school status, employment, support status, family relationships, peer relationships, psychiatric status. This is an objective screening that helps determine participant treatment needs. The adolescent SASE is found to produce reliable results using both test, retest, and internal consistency methodologies. The reliability of the SASE is 89%. Accuracy is not significantly affected by gender, age, ethnicity, education, employment status, living situation, or prior history of law violations. The SASE also contains a defensiveness scale. This scale indicates the honesty with which students answer questions. These well-rounded scales allow the SASE to accurately identify substance use disorders. The research associated with outcomes can be found on the SASE website. Upon screening, the student will be asked all of the SASE questions by the counselor, and then the counselor will determine the SASE score. Based on the results of the screening, the counselor will make a recommendation for continued care. In summary, RISE is designed to help identify Tomball ISD students struggling with substance use disorders, utilize an objective screening to measure the level of impairment, and provide them with services as opposed to simply utilizing disciplinary approaches.